Welcome to the Veterans Voice. My name is Joe Armstrong. I'm the president of Vietnam Veterans of America, Chapter 1044, and we're located in Biddeford. During our monthly VVA meeting on Sunday, August 5th, we had the opportunity to learn about an exciting Medicare health insurance plan that can help the veterans in Maine in ways that the VA does not. And I wrote about it in our September newsletter. The plan is called the AARP Medicare Complete Choice Plan 1. And we just happen to have the booklet right here that you'll receive when you attend the seminars. Very importantly, this plan does not, and I repeat, does not interfere or conflict with the VA benefits, but offers coverage and benefits that the VA cannot afford, or offer. And remember, pays zero premium, zero. You don't hear that word too often, to have the plan. After hearing about this plan and learning about the coverage and benefits, it was clear to me that this is a no-brainer for Maine veterans and non-veterans alike. And why? I wanted to talk about it on this show. My wife and I are so excited about it that I will be the first veteran to enroll on the morning of October 15th, which is the beginning of the Medicare open enrollment. The man who introduced this information to me and our local VVA chapter is here with us today. His name is James D'Ambrosio, and he is the independent career agent with United Healthcare. James, it's good to have you on the show.
Joe, it's a privilege. Thank you for having me.
Can you tell us a little bit about yourself?
My parents brought me up to believe that we're here to do something good in the world and to make a difference and to touch each other with kindness. So everything I've done, and I've done quite a few different things in my life, has always centered around doing good. For 12 years, I coached over 30,000 cancer patients all over the United States with a revolutionary natural supplement called shark cartilage. I moved to Martha's Vineyard for a number of years, and I wrote professionally for the Martha's Vineyard Times and also op-ed pieces for the Vineyard Gazette and Cape Cod Life publications. And all of those stories had a social impact. I was always interested in what's happening to real people and how that matters to all the rest of us who might not be able to hear their stories. 3 years ago, I moved to Maine, especially when I discovered there was a very large and growing senior community here. And my mother's 76. I lost my dad some years ago. And I have a deep respect for seniors because we're all going to be one. And I thought, while I'm young and I have the energy, I'd like to contribute something to seniors. And maybe someday, when I'm a senior, somebody will care enough about me to help me. So I got involved with United Healthcare in the Medicare space. And it's been an absolutely joy-fulfilling situation for me thus far.
Sounds like you've had a very exciting career.
I have so
and
far,
we're,
yes.
we're very privileged to have you here. But why do you represent United Healthcare?
Well, when I was considering the different insurance companies that are licensed in Maine, I wanted to come back to representing the company and the plan that I want for me when I become Medicare eligible, when I turn 65, which will actually be 9 years from now. And after all my research, United Healthcare and its partnership with AARP came out to be the one. What you want is you want a company that has stability and that has been around long enough to have weathered many different economic changes and in many different changes in the insurance field. United Healthcare has been around for over 30 years.
Wow.
They have more Medicare beneficiaries than any other insurance company in the United States. We just topped 12 million members.
Wow.
They are on the Fortune 500 list as the #6 company. So that means they have great financial strength. Because remember, the plan that you're on is only as good as the carrier who's covering the plans. Right. That's that stability factor. The other thing that really struck me about United Healthcare is their deep sense of community. Just last year alone, their employees contributed $42 million in total to a variety of charitable organizations. Those employees also logged in 1,250,000 volunteer hours. That to me speaks deeply of their sense of community and why they're in the Medicare space to help others. It was a no-brainer for me to represent.
Sounds great. What kind of plan is the Medicare Complete Choice Plan 1?
So this is what we have commonly come to know as a Medicare Advantage plan, which is otherwise known as Part C. In the Medicare space, you've got three options. You can stay with Original Medicare, which is the little card with the red and blue stripe at the top that says Part A, which is a hospital, Part B, which is medical.
Right.
But most folks don't just stay with Original Medicare because it leaves you with a 20% risk exposure, things that it won't cover.
Right.
So most select one of two avenues. One of the avenues is what we have come to know as Medicare supplements, also known as Medigap insurance, which are private insurance plans, and they come with a premium each month that can be expensive. They don't cover prescription drugs, so you need an additional plan known as a prescription drug plan. That can have also a substantial premium depending on what kind of plan you get. So those two premiums added together can become expensive for some seniors. The second and other option is called Medicare Advantage. The government designed this. This is a federally invented and designed plan, and it actually has three parts in it. Part A and Part B, which is Original Medicare, that the insurance carrier basically takes over on behalf of the Center for Medicare Services. So whichever company that your Medicare Advantage plan is issued through is managing your Part A and Part B. In addition to that, it also includes Part D, which is the prescription drug plan. So you have three parts all in one plan that you use with one card. This plan that we're talking about today is one of those plans, the Medicare Advantage plan.
Awesome, awesome. Let's look at a few areas of healthcare and how the plan would help a veteran. Let's take emergency room. If a veteran has an emergency and he can't make it to the VA hospital, he'll face a large bill out of pocket at the local hospital, maybe $1,500 or more. James, how much would it cost for an emergency room visit with your plan?
Sure. So the plan we're talking about today is actually the 2017 plan because we're still a little early to reveal to the public the 2018 benefits, but it'll be very similar. So with the 2017 plan, the veteran will have a copay of $75 anywhere in the world. That he needs an emergency room service. Wow. This is key. So if he's just looking at this plan just to have that as an option, that's an enormous benefit.
Yeah, it sure is. I mean, in the world, it's mind-boggling.
Indeed. If he wants to go on vacation with his wife in Europe and something happens. If he wants to go to Canada, just across the border up by Calais, something happens. Anywhere he is, if there's an emergency room service rendered, he's looking at a $75 copay.
Wow, that's amazing. Here's a big one, ambulances. Again, if a veteran suffers an emergency and it's too far away from a VA hospital, an ambulance can be very expensive, as we all know, and come out of the veteran's pocket. Does this plan cover ambulance services? And if so, how much would a veteran have to pay?
So this particular plan has a copay of $250 for an ambulance. Clearly, just like they do now, they're going to take the veteran to the nearest emergency area, which is oftentimes to his benefit.
Right.
So in our system, in our network, that's $250 copay. And there are no limits to how many times he might need an ambulance in a single plan year. The same with the emergency room. Okay. If he has multiple events, each event would either cost $75 for the emergency room service or $250 per ambulance ride.
So that's unlimited.
Yes, it is.
That's amazing. Physicals. In order to get a physical at the VA, you have to call, and it can be a considerable wait time to get your physical. James, does this plan include a physical?
It does. Actually, the veteran can have two physicals, and each one is $0 out of his pocket. The first physical would be at his primary care physician's office. The second physical is one of the benefits that we offer called house calls. We have a network of traveling nurses all across the United States, and what comes with this plan is one visit from one of our nurses per calendar plan year, where she would come, or it could be a he, and sometimes it's even a doctor. It all depends on who's available. To your home, it's a full physical. They'll sit down with you. They'll talk about any changes that might have happened since they've taken notes about it prior. They'll talk about your meds, any concerns you might have. Anything you want to talk about is included in the entire physical, and that is $0 for the veteran.
$0. And let me get this straight. They'll come to your home.
Yes, they will.
It's unheard of nowadays Doctors don't make house calls.
We have, especially the older demographic of seniors we have, they really love our nurses. I mean, some of these folks don't get out much.
Exactly.
And not too many people call them or come and visit, except maybe family members. So to have a nurse come and sit with you, have a cup of coffee, talk about whatever, they just love that. And our nurses are handpicked. They're all extremely friendly, and they do what they do, not because they have to, but because they love being there for seniors in this unique way.
So you're more or less fulfilling two things: the medical aspect for the physical, but companionship for the
Absolutely.
Wow, that's amazing. Choices for specialists and providers. If a veteran faces a certain condition, he must seek treatment in the VA facility to be covered by the VA. What kind of access to specialists and providers does this plan offer?
Sure. So this is what we call a PPO plan, which stands for Preferred Provider Organization.
Okay.
And this plan covers the member in network and out of network, not just in Maine, but all over New England in the United States. There are 32 states in the country that are considered in network, and the others that aren't are out of network. So the plan covers you in network and out of network.
Okay.
That includes primary care physicians, and it also includes specialists. So let me emphasize what this actually means in real terms. Let's say you develop a cardiac condition. The two conditions that people are very concerned about, because they can be very expensive and they're very specialized because it's life-threatening, are cardiac issues and cancer. Both of those are life-threatening and can be very expensive. So you're trying to seek coverage that can get you well and that you can afford to come out of it with all your assets. So let's talk about a cardiac issue. Suppose you have a cardiac condition of some kind. And the VA has terrific specialists. But let's suppose there's a particular provider in Boston that you've heard about, that you've read about, that really specializes in that thing. This is your life. And you'd like to go there to be treated. Well, the systems in Boston are in our network. So with our plan, you have a choice. You can seek care at the VA, or you can seek care within our system in Boston. So all of a sudden now, the veteran has virtually a new universe of choices anywhere in the country that he didn't have before. And that's extremely important, especially if you're dealing with a condition that could possibly threaten your life.
Let me ask you a question. Hypothetically, I'm being treated at the VA by a specialist up there. For whatever reason, I want to get a second opinion. Do I need a referral from my specialist at the VA to go to a second specialist?
No. And within our system, there are no referrals necessary either.
Oh, okay.
So if you have a primary care doctor, which you would in our system, you can see any specialist that you want without even talking to your primary care doctor.
Wow.
It has the utmost freedom, and that's very important in United Healthcare, because this is based upon wellness. It's based upon you feeling that you're well cared for. A big part of that is choice. We want you to feel empowered to make choices based on the information that you have. So no, you don't need referrals.
That's fantastic. You know, it sounds very expensive. How much would a visit to a specialist cost with this plan?
If you are in network with our system, which is most likely where you'd be, especially in this part of Maine, because we have so many providers, it's $35 copay. And you can see as many specialists, as many different specialists as you wish. You can go to that same specialist as many times as you want. In that plan calendar year, it's $35 a visit.
And does this hold true for regular doctor visits as well, $35?
The regular doctor visits, otherwise known as primary care physician, is a $5 copay in our network.
Wow. It's funny because that was my next question. Primary care physician. Veterans have primary care doctors at the VA. Would they have a different primary care doctor with this plan?
Yes, they would. And they can change primary care doctors with a phone call as many times as they wish. Because you know that there is an interesting dynamic with doctors. You want a few things to align together. You want him to be well trained. You always look at his credentials on the wall to see where he got his education, what kind of board certifications he has. And you also want to connect with him as a human being.
That's
I mean,
really
he's a
important.
human being, he's a person. And you want him to, you want to feel that he cares about you, that you're not just a patient, not just another appointment, and that he has an instinct that'll be developed over time of how you tick, how your body works, the things that you respond to. And all of those things are oftentimes tricky to find in a single person. So that's why we allow a member to change doctors as often as they wish to find that final combination.
I know we talked briefly about this, but how much would a visit to the primary care doctor cost? Please tell us again.
It'd be $5 copay.
$5.
$5 in our network, and it doesn't matter how many times you want to go. It's always going to be just $5 with that doctor in our network during that calendar year.
That's amazing. Most of us spend more than that at breakfast in the morning for coffee and donuts. I mean,
Indeed.
just amazing. How about access to nurses? James, please tell us how a veteran would have access to nurses with this plan.
Sure. So we have something called Nurse Line, and a member of this plan can speak to a registered nurse, not an LPN, but a registered nurse, 24/7, every single day of the year for any reason whatsoever. Let me give you some examples.
Wow.
Let's suppose you're having dinner, you're watching the evening news, and some health topic comes out and it concerns you. And you'd like to talk to a health professional who might have some more information. Call our nurses. Say, hey, I just saw this program, this report on the news. Do you know anything about that? Let's say you wake up at 2 o'clock in the morning, you just don't feel right. Something just doesn't feel right. And you want to speak to somebody first before you make some decisions or take some action.
Right.
Call up one of our nurses. Every time that you speak to our nurses, she'll ask for your ID number. That way she has your file right in front of her. Whatever you discuss with her goes into your file, and that is made available to your primary care doctor. So let's suppose it is a health concern that you wake up with. Your primary care doctor is going to be alerted to it. The idea about this is designed around what we call coordinated care. We want everybody on your team in our plan to be aware of what's going on with you as often and in real time as possible so that everybody can take steps to get ahead of it. Oh, and actually, I almost forgot. The second access to nurses is what I mentioned just before with house calls.
Yeah.
You'll be able to visit in your home once a year with a nurse to talk about anything you want while she's conducting a physical.
And at that time, they'll go over your meds and everything?
Everything, and the same thing. She records everything. It goes right back to your primary care doctor. So anything that he's concerned about that he learns through her, you're probably going to get a call to come in and take a look at it, because this is a wellness preventive approach, which probably is the best future for medicine in this country, is to get ahead of it, because it's a lot easier to keep you well and a lot less expensive from the carriers and insurance perspective than to treat you once you're sick.
Oh, I
and this
agree.
whole thing is about keeping ahead of something going on.
I agree 100%. We're talking about how expensive things are. Co-pays for medicine. We get prescription medications through the VA. Sometimes the co-pays can be really add up. How does this plan work with prescription medications?
Okay, so as I mentioned when we first started, this has Part D built in, which is the prescription drug plan. All prescription drug plans are based on what we call a formulary, which is a list of all the covered drugs, both generics and name brands, and each one is divided into tiers, tier 1 to tier 5. So tier 1 and 2 are the least costly, oftentimes the most common medications that the general population uses. Tier 5 are typically very specialty experimental level drugs, which can be very expensive and oftentimes require some kind of prior authorization because of the nature of that particular medication. With our prescription drug plan, you can use it in a retail store, like a Walgreens or Hannaford's, and you can also get your prescription medications through what our mail order program is called Optum Rx. If you have a tier 1 or tier 2 prescription, which again are the most often used, the most commonly used, with our mail order program, it's a zero copay for tier 1 and tier 2. That alone can be very different in terms of savings compared to what other programs, including the VA, might charge you for a copay, because this is a different system entirely. And again, it gives the veteran that choice. And he can shop. He can take a look at what's the copay going to be for the same drug
Yep.
at the VA, and what's the copay going to be with my Medicare Advantage plan with United Healthcare. And whichever one is the least, that's the one to do.
Well, I'm speaking from experience. I've had my primary care doctor prescribe a medicine for me, but because he didn't prescribe the generic name, the medicine cost me almost $160, which is, I had to refuse the medication because I couldn't
Was that
afford
per
it.
month?
Per month, yeah. Do you think it would have been cheaper if he went generic? And if it is cheaper, is it as cheap as your program?
Sure. The one area of medical insurance costs that each individual insurance company has no control over is the cost of prescription drugs.
Oh, okay.
The drug companies run that game.
Oh. Okay.
They're very expensive. Maybe in the future something will be different, but this is the world we live in right now. And all of us watching this program right now know how expensive prescription medications can be, especially if you need them. There's something that each individual can do to try to lower their out-of-pocket costs for prescription drugs. The first is always ask your doctor, is there a generic for this medication that you're prescribing for me? You have to remember, doctors are under a lot of pressure. They have lots of patients, some of them over 1,000. And they're on a time clock. They only have so many hours in the day and so many slots that they can meet each patient. And you don't know what mood they're in, how their day's going. They might just reach into their arsenal and say, Joe, you need this brand drug because it's what we're using. And he gives you the script, and then the next patient comes in. And he might not be thinking about generics because he's not the one making the copays. You are. The patient is. Always stop him. Doctor, is there something else that's a generic that can do what this does? Even if maybe it doesn't do exactly what this brand does, can it be close enough where you'd be satisfied as my caregiver that this would be good for me to do? Because the generic is always going to be less expensive than the brand name.
Right.
So with the tier system, Tier 1 and Tier 2 drugs are going to be the least expensive copay. So depending on what that medication that you're referring to is, we would simply look, as let's say you're a member, into our formulary, and the formulary will tell us if there's a generic.
Oh, okay.
And it'll also give us the copay that it would be for that medication. And it gives us options, things that we can use to choose from.
Okay. Is that the book that we have sitting in front of us, Jim?
Yes, that has an abridged formulary because the formulary itself is very large.
Oh, okay.
And we couldn't print it in all of these enrollment guides. Everybody in the United States who signs up to enroll with a Medicare Advantage plan receives the enrollment guide, which has a very easy to understand description of how the plan works, how the different parts are covered, and an abridged, which is a shortened version of the formulary, which typically has the most commonly used medications. So someone can just flip and say, oh, this is the name of my drug, let me see, because it's all alphabetized. Oh, there it is. And then it'll classify it on what tier it is, T1, T2, 3, 4, 5, and then you just go to the table and it tells you, depending on retail or through our mail order, what your copay is going to be. So it's very easy to know what this plan's cost is going to be for your copay on your drug.
Sounds like I said in the introduction, it's a no-brainer. And all this can be sent to your home?
Yes, the OptumRx program will mail to you with no shipping fees. And that way, I mean, sometimes it's not easy to go out to the pharmacy.
Exactly.
For whatever reason, you're in the middle of a blizzard. As an ice storm, it's just, you don't feel well, but you're out of your medications, you need to get them. So if you can plan a little bit ahead of time, you can always receive them at your door through the mail order program. And whether you're using Tier 1 all the way to Tier 5, there's always going to be that discount because we're bypassing that middle sector. So we can pass on those savings to a less costly copay when you use our mail order program. And most of our members, and again, we have 12 million now, use that because it's the least expensive.
My wife and I will be
And again, it's a zero copay for T1 and T2s.
Yep.
It's hard to get less expensive than a zero copay.
Wow. Speaking about staying healthy, how about vitamins and minerals? The VA does not offer credits towards vitamins and minerals and things you would get over the counter at a local retail store. James, please explain how the veteran would receive credits towards over-the-counter products.
Absolutely. One of the exciting additions to our plan is our own catalog. It's an over-the-counter catalog. You can order things by mail. You can order them online. And what we do is we give you a $50 credit each quarter. So that's $200 of credit, actual money, to spend on things that you would typically find in a pharmacy that you don't need a prescription for. Aspirin, headache pills, dental products, toothpaste, vitamins, minerals, thermometers. There's some monitoring supplies for diabetes. There's a variety of categories of things that the plan covers, and that will grow over time. And when you first begin, whether it's you're talking to someone on the phone, or you're ordering it by mail, or you're online, you'll see a $50 credit. Spend the $50.
Okay.
Spend the whole thing, because it won't carry over to the next quarter. Whatever credit was in there that we gave you will be wiped clean, and we deposit another $50 in credits.
Okay.
So every 3 months, you've got a new $50 to spend on these items. And that can be a great help, especially to seniors who might be on a fixed budget, and so many are.
Definitely.
Where a bottle of multivitamins is a concern, maybe some headache pills, that's a concern, or some of these other items that you can get over the counter are just a little bit over their budget. Well, now they're going to have $50 extra, so that it can now give them some options to actually use those things. And we do this because we know if you're using products like this, you're taking care of yourself. And again, back to that central preventive wellness aspect that this plan is designed around, if you're taking care of yourself, there's a better chance of keeping you from getting sick.
Oh, I agree.
And that's worth it from us, your insurance carrier, to invest this $50 every quarter to help you do that.
Now, what happens in the case of a husband and wife? They both qualify, they both sign up. Now, that's $50 each, or that's just for the two of them?
Exactly. Because these are Medicare plans, they're always individual plans.
Oh, okay.
So if you're husband and wife, each one of you has your own plan. They're identical, but they're assigned to you individually based on your Medicare ID number.
Okay.
So yes, for a husband and wife, you each have $50 every 3 months.
So instead of 200, you're getting 400.
You're getting $400
Wow.
for the household.
That's amazing. That's amazing. Next thing I'd like to talk about is something I'm going to need very shortly: hearing aids. If a veteran needs hearing aids, he has to apply to the VA, and he has to show that the loss of hearing was occurred during service or combat situation. He might be turned down under the VA rules. Can this plan help a veteran with hearing aids? Yes,
and this is actually something we're very proud of. With our plan, it's a $5 copay to go to one of our hearing specialists. And to find one, just call us. Tell us your zip code, give us an idea of how far you're willing to drive, and we will give you a provider that's in our system that is a hearing aid doctor. We could even help you set up an appointment. So you go to him, he'll do your hearing exam. If he detects that you need hearing aids, he'll measure each ear and do what he does, and it's just a $5 copay. What he then does is he sends the order to our manufacturing facility. United Healthcare is the only insurance company in the Medicare space that owns its own manufacturing facility.
Oh, wow.
We make them. Hearing aids can be enormously expensive, and Medicare or Medicare supplements do not cover them. Oftentimes, companies will offer a discount, 5–10% off of a retail price, which is terrific. That's a lot of money, because hearing aids can be many thousands of dollars each.
Wow.
With us, you're looking at a copay range of $330 to $380 for each hearing aid, and we can offer you 2 per year. This is a benefit that comes with the plan, and this is huge. Because, as we know, I just turned 56 yesterday. Our eyes start to get weak. Our hearing can get weak later on. Sometimes people have accidents and it damages their hearing. There are no qualifications necessary to get a hearing aid. It doesn't matter why you're losing your hearing. There is no process or application or something you can be turned down for. If you suffer hearing loss or you already have it, you just go to one of our hearing aid doctors, he'll test you, and you'll get your hearing aids for $330 to $380 for each one with this plan.
And that's 2 hearing aids per year.
Exactly.
So if you need 2 hearing aids, You just get those two, and then you have to wait the following year.
Exactly right.
And what, you just go in and get reevaluated, and if
And if
needs any
anything's
upgrades-
changed, he'll retest you
Okay.
and order newly designed hearing aids to match whatever's going on at that time.
And these will be shipped to you free?
I believe you actually pick them up.
You pick them up? Okay, great, great. You know, we've heard the term, if it sounds too good to be true, it is. Premium costs. The plans offer this coverage and benefits at zero premium. Does that mean it's really free?
And I get this question a lot because we're trained to hear zero. We think zero means free. And we've been around long enough to know that there's nothing that's really free.
Right.
There's always some catch. This is a federally designed plan. It has to be exactly as it's printed because all of it, every single page, everything that we as a company and licensed agents are allowed to represent to the public is all approved by the Center for Medicare Services, or we can't represent it.
Okay.
If it says zero premium, it means zero premium. It doesn't mean that it's free. Let me explain.
Okay.
When we first started talking, I referred to the other path that a person who has original Medicare Parts A and B can pick, which is Medicare supplements. Medicare supplements come with a premium because they're private insurance plans. So you pay X dollars to basically rent that insurance coverage every single month, whether you're using it or not using it.
Okay.
Same with the prescription drug plan. Because it's a private insurance plan, the carriers, each individually, are the ones who determine what the premium is.
Okay.
The Center for Medicare Services does not. They simply have something called standardization. There are different letters in Medicare supplement plans, Plan A, Plan N, Plan F. No matter what carrier is offering that letter plan, it has to be exactly the same as any other carrier offering that same letter plan.
Okay.
That's where the government regulation ends. So company A can charge X for it, company B can charge Y for it, different premiums for the same exact letter plan.
No.
With this Medicare Advantage plan, it's a different system altogether. Because remember, it includes Part A and Part B.
Right.
Well, you've already paid into your Part A premium through all your Social Security earned credits.
Right.
So you're not typically paying Social Security credits anymore for Part A. You've already paid into the system during your taxable working life. Part B, which is the medical insurance side of original Medicare, you will always pay, usually right out of your Social Security benefits.
I was just going to say that's a deduction every month.
Yep, and that you will always pay that.
Okay.
And that can fluctuate from year to year. And that's all under the control of the Social Security Administration. Because Part A and Part B are already in Medicare Advantage, that's already built into the plan.
Okay.
And the government pays a fee to every single insurance carrier in the Medicare space who have Medicare Advantage members, because those carriers are managing the Medicare space on behalf of the Center for Medicare Services. It's a great relief of burden on the Medicare Services Department, because each carrier is managing that same Medicare eligible person in its individual system. It takes a tremendous burden off. Also, because Medicare Advantage is a managed care system where providers agree to a fixed price and they cannot change it
Right.
for that entire calendar year, those prices typically are lower than what you would find on the open market, which is what original Medicare is. So the savings is great, and that's why the government pays a fee, a sort of thank you for managing this member on our behalf and saving a tremendous amount of money in medical costs. In the state of Maine, this is a very progressive state. This area, which are 10 counties, and I'll go over those in a moment, that this Plan 1 covers, it just so happens that the medical reimbursement costs, mixed in with the fact that this has Part A and Part B and premiums have been paid into that, mixed in with the fee that's paid to United Healthcare to help afford and run this system, all of those things combined, which are very complex calculations and negotiations, it just turns out that you, the member, do not need to put in any more premium dollars to drive the plan. Zero premium means you don't have to pay any more.
Okay. So let me get this straight. This is not a supplement.
Correct, it's not.
It's a separate.
It's a separate,
entity
it's a separate
Wow.
category altogether.
That's great. Can anyone apply for the zero premium plan?
So you need to have original Medicare. You need to have Part A and Part B. Some folks just have Part A because they have some kind of other credible coverage, was what we call it, for their medical insurance side of it, and they don't have Part B. But to have a Medicare Advantage plan, because it has both A and B within it, you need to have both parts, A and B.
Okay.
It doesn't matter how old you are. Typically, you're 65 plus when you become Medicare eligible, but if you've been qualified for Social Security disability income, you might have been qualified earlier than age 65 for original Medicare.
Okay.
So it's less age dependent. It's specifically, you need original Medicare Parts A and B. You need to be within one of the 10 counties that this plan covers. And I'll put my reading glasses on so I can see the little type. You need to live in Androscoggin or Cumberland, Franklin County, Kennebec, Knox, Lincoln, Oxford, Sagadahoc, that one always gives me a tough time pronouncing it, Waldo, or York counties. If you live as a resident in one of these 10 counties, this plan is a zero premium plan for you.
Wow, that's quite an area.
The only thing that could disqualify you from the plan is if you had what we call end-stage renal failure, which in layman's terms, both your kidneys are in pretty bad shape and you're using dialysis.
Okay.
That's not generally the case for most people.
Okay, well, last question, I promise. Seems you're very passionate and committed to offering this plan to Maine veterans. Why is that?
So my two dads were veterans. My father was a naval communications specialist on a destroyer off Korea. And he was hired later in life to be on the Mercury project with NASA.
Oh my God.
I was born in Miami and I lived as an infant in Cape Canaveral. And my father was part of the team that put Alan Shepard in space.
Wow.
He was absolutely as American as they come. Wore the flag proudly, spoke about America like it was his own family. And I grew up with that. I've got a beautiful black and white photograph of John Kennedy shaking my dad's hand because he came to the base after the successful launch and recovery of Alan Shepard. And that was the glowing moment of his life. My second dad was a naval aviator also during the Korean era. He flew P-47 Thunderbolts that were left over and did some amazing bombing runs and so forth. So I've grown up in this deep, profound sense of giving service, and I wear who the veteran is and everything that he and she is committed to very closely to my heart. In fact, I mean that literally. I wear this scapular medal.
Oh, wow.
This was worn by an American GI in France during World War II.
Wow.
I don't know who he is or who he was. But what I do know is he prayed a whole lot because he wore off with his fingers the silver plating on this brass medal.
That's amazing.
I found this literally on eBay last Christmas, offered by a convent of nuns in Europe who were given this by a military chaplain from another military chaplain that this young man passed it to. Wow. And somehow he survived the war, and this little tiny medal survived. And the moment I saw it, I felt such a deep connection because of this man's commitment and his belief that he was going to make it through and everything was going to be okay. And I wear this because I think about whoever that young man was and everything that he stood for. I am very privileged to be here with you and to work with you on this mission, which is to make this plan available to every Maine veteran who qualifies for it that we can for this upcoming Medicare open enrollment, which is beginning on October 15. It only runs 7 weeks and ends December 7. When I started doing some research on how many Maine veterans there are that are at least 65 years old or older, it was staggering. In the 10 counties that this plan covers, as of 2015, there were 42,000 of them.
Wow.
In just York and Cumberland counties alone, there are 19,000 of them. That is a lot of human beings that could have this plan, which is going to cost them $0 premium per month just to have it, where they can reach into any of these benefits at any time that are unique, that aren't necessarily offered by the VA. and they don't interfere with the VA. And I feel very passionate about making that available because of everything they've been through. Veterans have been through an experience that nobody can know except another veteran. I can't know it. I went through the training. I graduated Officer Candidate School with the United States Marine Corps in Quantico, Virginia in 1982. My dad wanted me to fly F-18s. The bird had just come out then. And then my dad got very sick. And my mom didn't have a job and didn't have a driver's license. And my little brother was only 8. I graduated the program, but I could not pursue a second lieutenant commission, which is where I was heading with the Marine Corps because my mom needed help. So I did not pursue it, but I went through the training.
Right.
And I developed a deeper concern and commitment around what veterans do, why they do it, and who they are to do it. And this is a way for me to help them within my ability. And that's why I'm very excited about being involved in this.
Well, you got quite a history there. I can't imagine growing up on Canaveral, watching the rockets go up. God, I see pictures and I get goosebumps. I can't imagine actually being there. It's amazing. There's more details about the plan that James will be discussing in person. We're hosting 4 private meetings in early October. The dates will be on the bottom of the screen for you. James, what kind of things will you be discussing at the meeting?
We're going to be going over more details about the plan. I'll be there to answer questions, and this is the time, this is very important. This is the time to come and understand and learn what this plan is so you can make an informed decision if this is something that you want to help in your health care avenue of your life. It's very important to come. I'll answer your questions. You can meet me. We can talk about anything you would like. And I'm going to do my best to inform you in the best way that I can of everything this plan does so the veteran can get an idea about what his choices can be, which are very different than the choices you have right now. So during these meetings, we're going to talk about all that. It's going to be a step 2 process. First step, second step. The first step are these private group meetings where we're going to talk about what the plan is, what it does, and how that can benefit you. The second step, which we will make known to you once we devise the schedule, is going to be during the actual open enrollment time, which again is only 7 very quick weeks. They go by very quick. Yep. That's the only time that most people can actually enroll in the plan, and it becomes effective on January 1. During those meetings, I will give an overview again of the individual plans. So if you needed a little refresher, maybe you didn't get to come to the private meetings and now you can learn about it during the group enrollment. The very important part about group enrollment is this is when we can actually enroll you. And because we're likely going to be using paper applications that are basically 5 pages, I can enroll as many as we can get into a room at the same time. So don't worry about how many people we might be able to enroll. It's virtually as many as will come. It'll only take about a half an hour. I'll lead you through each section, one at a time, through the 5 pages. So we're all on the same page together. And by the end of the 5 pages, I'll collect them all with my assistants, and as of January 1st, you will be enrolled in this plan. It's very important to consider this now because open enrollment is coming, and once December 7 passes, we won't be able to enroll you until the following year.
Okay. I'd like to reiterate what James just said. It is very important that the veterans, families, and friends interested in having this coverage and these benefits in their lives need to attend the private group meetings so they can understand how the plan works and get all the questions answered. James, what happens after the private group meetings? How do the veterans actually enroll?
They're going to enroll when they come to the group enrollment meetings, which you and I will work together to devise the schedule.
Yep.
The idea is to have specific locations at specific dates and times where I will be there for that window of time. And you can come and I will review the booklet of the 2018 plan because I'll have it by then. We're just a little early from October, so I don't have it now. I'm not allowed to. And at that time, if this is a plan you want to pursue, we'll get you enrolled and we'll take care of you. My mission is to enroll every Maine veteran, their families, their friends that want this in their life, this open enrollment.
Okay. I just want to make it, rehash it over. Although we're talking about veterans, this is open to non-veterans as well, as long as they're receiving the Medicare and they have the red, white, and blue A and B card. Is that correct?
That's exactly right.
Okay. When they come in, what should they bring with them for proof or evidence?
Sure. So every person who attends the group enrollment meeting will need to bring their original Medicare card so that I can see that they have one. I can see that they have Part A and Part B. That way I'm doing my due diligence as a licensed agent in the Medicare space. They can certainly bring their veteran VA benefits card if they have that with them. However, it's not mandatory because we will discover that in the system, because all of these things are always routed back to your Social Security number. So if you don't have your VA card, don't worry about it. United Healthcare will discover it. But you need to have your original Medicare card with you. And that's all you need to bring.
Sounds great. You know, James, this sounds like a remarkable program, and we look forward to hearing more about it at our upcoming group meetings. I want to thank you for coming here today and giving everybody a chance for this opportunity. And I want to thank you for watching. And remember the important thing, don't give up the good fight. Until then, thank you.